Thank you very much. So good morning, good afternoon. Thank you for joining us. Today I'm here to talk to you about Health Canada's authorization of Pfizer-BioNTech's Comirnaty COVID-19 vaccine in children 5 to 11 years of age. This is the first vaccine authorized in Canada to prevent COVID-19 in younger children and is another key step in Canada's fight against COVID-19. I'll start by walking you through Health Canada's stringent review process and the data we reviewed. I'll finish with some important information on COVID-19 in children. Health Canada received a submission from Pfizer-BioNTech to authorize the use of its COVID-19 vaccine in children 5 to 11 years of age on October 18. Our assessment included a review of new clinical trial data that built on earlier lab data, data from clinical trials in adults and adolescents, and real-world data on the use of hundreds of millions of doses worldwide. The trials follow approximately 4,600 children, 5 to 11 years of age. 3,100 received the vaccine, and 1,500 received a placebo. The study used a 2-dose vaccine regimen given 3 weeks apart, but with a slightly different formulation than the one authorized for adults. The dose of mRNA is also smaller at 10 micrograms rather than 30 micrograms. To determine whether the vaccine is effective, we looked at the immune response in children 5 to 11 compared to the response in adolescents and young adults 16 to 25 years of age. The immune responses were comparable. Safety data was evaluated for 1,518 vaccine and 750 placebo participants, of whom the vast majority, or over 95%, had a safety follow-up of at least 3 months after the second dose. The trial also evaluated safety data from an additional 1,591 vaccine and 788 placebo participants with a median follow-up of 2.5 weeks after the second dose. The main adverse events reported were similar to those in adolescents and young adults, but were less frequent, except for redness and swelling at the injection site, which were slightly higher. Other adverse events reported included fatigue and headache. Most reactions were mild to moderate in severity and resolved quickly on their own. Among the 3,100 vaccine recipients, there were 4 reports of serious adverse events that were ultimately determined to be unrelated to vaccination. There were no reports of myocarditis, pericarditis, or severe allergic reactions. After a thorough and independent scientific review of the evidence, the department has determined that the benefits of the vaccine outweigh the potential risks in this younger age group. As with all authorized COVID-19 vaccines, Health Canada has issued terms and conditions on the manufacturer requiring it to closely monitor any emerging safety issues, including any cases of myocarditis or pericarditis. Health Canada and the Public Health Agency of Canada will continue to work with the provinces and territories, the manufacturer, and regulators around the world to monitor the safety of the vaccine. We know this collaboration has been able to quickly identify even very rare and unexpected side effects. To date, no new safety issues have emerged from the use of Comirnaty in children 5 to 11 years of age in the United States, where over 2.5 million children have received their first dose. This authorization comes at a critical time in the pandemic. Over the course of the 3rd and the 4th waves, incident rates have been increasing among children less than 12 years of age, who until now have not been eligible for vaccination. While children are less likely to experience complications, they can still get very sick. Although the risk of severe illness is lower in children than in adults, it's still there. And rarely, some children go on to develop multi-inflammatory syndrome in children, known as NACI, which has a very high risk of requiring hospitalization. Emerging data also suggests that children with COVID-19, regardless of the severity, can develop long COVID or post-COVID symptoms that may continue for months. And children, like adults, can spread the virus. Now that the vaccine is authorized, I'm sure everyone is anxious to hear how it will be used. Dr. Tam and Dr. Njoo will be providing an update shortly. In conclusion, I'd like to reflect on what this authorization means for people in Canada. Overall, this is very good news for adults and children alike. It provides another tool to protect Canadians, and to the relief of many parents, will help bring back a degree of normality to children's lives, allowing them to more safely do the things that they have missed during the last 20 months. Thank you. Merci. Miigwech.
Bonjour. Merci de vous joindre à nous. Aujourd'hui, je vais vous parler de l'autorisation de Santé Canada concernant le vaccin contre la COVID-19 Comirnaty de Pfizer-BioNTech pour les enfants de 5 à 11 ans. Il s'agit du premier vaccin autorisé au Canada pour prévenir la COVID-19 chez les jeunes enfants et il s'agit d'une autre étape clé dans la lutte du Canada contre la COVID-19. Je vais commencer par vous présenter le processus d'examen rigoureux de Santé Canada et les données que nous avons examinées. Je terminerai par quelques renseignements importants sur la COVID-19 chez les enfants. Le 18 octobre, Santé Canada a reçu une demande d'autorisation de Pfizer-BioNTech pour l'utilisation de son vaccin contre la COVID-19 chez les enfants de 5 à 11 ans. Notre évaluation a impliqué un examen des données, de nouveaux essais cliniques qui complétaient les données d'études antérieures, des données d'essais cliniques sur des adultes et des adolescents, ainsi que des données d'utilisation réelle de centaines de millions de doses dans le monde entier. Les essais ont suivi environ 4 600 enfants de 5 à 11 ans, dont 3 100 ont reçu le vaccin et 1 500 ont reçu un placebo. Dans le cadre des études, on a eu recours à un schéma vaccinal de 2 doses administrées à 3 semaines d'intervalle avec une formulation légèrement différente de celle autorisée pour les adultes. La dose était également plus petite, soit 10 microgrammes au lieu de 30 microgrammes. Pour déterminer si le vaccin était efficace, nous avons examiné la réponse immunitaire des enfants de 5 à 11 ans par rapport à celle des adolescents et des jeunes adultes de 16 à 25 ans. Les réponses immunitaires étaient comparables. Les données sur l'innocuité ont été évaluées pour 1 518 participants ayant reçu le vaccin et 750 participants ayant reçu le placebo, et une grande majorité d'entre eux, soit 95,1 %, ont fait l'objet d'un suivi d'innocuité d'au moins 3 mois après la deuxième dose. Dans le cadre de l'essai, on a également évalué des données additionnelles sur l'innocuité de 1 591 participants ayant reçu le vaccin et 788 participants ayant reçu le placebo, avec un suivi médian de 2,4 semaines après la deuxième dose. Les principaux effets indésirables signalés étaient semblables à ceux observés chez les adolescents et les jeunes adultes, mais étaient moins fréquents, à l'exception de la rougeur et du gonflement au point d'injection, qui étaient légèrement plus fréquents. Les autres effets indésirables signalés comprenaient de la fatigue et des maux de tête. La plupart des réactions étaient d'intensité légère à modérée et se sont rapidement résolues d'elles-mêmes. Parmi les 3 100 participants vaccinés, 4 événements indésirables graves ont été signalés, mais il a été établi qu'ils n'étaient pas liés à la vaccination. Aucun cas de myocardite, de péricardite ou de réaction allergique grave n'a été signalé. Après un examen scientifique rigoureux et indépendant des données probantes, le ministère a déterminé que les avantages du vaccin l'emportent sur les risques chez le groupe d'âge des 5 à 11 ans. Comme pour tous les vaccins contre la COVID-19 autorisés, Santé Canada a imposé aux fabricants des conditions exigeant qu'ils surveillent étroitement tout nouveau problème d'innocuité, dont des cas de myocardite et de péricardite. Santé Canada et l'Agence de la santé publique du Canada continueront de collaborer avec les provinces et territoires, le fabricant et les organismes de réglementation du monde entier afin de surveiller l'innocuité du vaccin. Nous savons que cette collaboration a permis de cerner rapidement même les effets secondaires très rares et inattendus. À ce jour, aucun nouveau problème d'innocuité n'est survenu à la suite de l'utilisation du vaccin Comirnaty chez les enfants de 5 à 11 ans aux États-Unis, où plus de 2,5 millions d'enfants ont reçu leur première dose. Cette autorisation arrive à un moment crucial de la pandémie. Pendant les 3e et 4e vagues, les taux d'incidence n'ont cessé d'augmenter chez les enfants de moins de 12 ans qui, jusqu'à maintenant, ne pouvaient pas être vaccinés. Les enfants sont moins susceptibles de souffrir de complications, mais ils peuvent quand même être très malades. Malgré que le risque de maladie grave est plus faible chez les enfants que les adultes, il demeure toujours présent. Dans de rares cas, certains enfants peuvent présenter un syndrome inflammatoire multisystémique ou MISC qui risque fortement de nécessiter une hospitalisation. Par ailleurs, de nouvelles données semblent indiquer que les enfants atteints de la COVID-19, peu importe la gravité de leur maladie, peuvent développer ce qu'on appelle la COVID longue. Et bien sûr, les enfants, au même titre que les adultes, peuvent propager le virus. Maintenant que le vaccin est autorisé, je suis convaincu que tout le monde est impatient de savoir comment il sera utilisé. La Dr Tam et le Dr Njoo feront le point à ce sujet sous peu. Pour terminer, j'aimerais m'attarder un peu sur ce que cette autorisation signifie pour la population canadienne. Dans l'ensemble, c'est une très bonne nouvelle, autant pour les adultes que pour les enfants. Il s'agit d'un outil supplémentaire dans notre arsenal pour protéger les Canadiennes et les Canadiens et, au grand soulagement de nombreux parents, Cette autorisation contribuera à ce que la vie des enfants retrouve un certain niveau de normalité, car ils pourront faire de façon plus sécuritaire les choses qui leur ont manqué au cours des 20 derniers mois. Merci.
Bonjour à toutes et à tous. Nationally, the daily case counts appear to be declining slowly, but with significant regional variation in disease activity and high infection rates persisting in many areas of the country. Over the most recent 7-day period, an average of almost 2,400 new cases were reported daily across Canada. Severe illness trends are also slowly declining, but some areas are still struggling at or above critical care capacity limits. As noted, unless we can keep infection rates down, severe illness trends could begin to rise again. Over the past week, on average, over 1,680 people with COVID-19 were being treated in our hospitals each day, including 487 in intensive care, and 25 deaths were reported daily. As the pandemic has progressed, we've learned, honed, and strengthened ways to manage as well as make headway against the formidable challenges of this virus. Canada's COVID-19 vaccines continue to provide excellent protection against severe illness. And although there's some evidence of decreased protection against infection over time, we are continuing to make important advancements in vaccine programs to preserve and extend their protection and help reduce spread as well. Over the past several months, regulatory approvals from Health Canada and recommendations from the National Advisory Committee on Immunization, or NACI, have allowed provinces and territories to adjust targeted vaccination programs to ensure that key populations can achieve and maintain protection against COVID-19. Approval of a pediatric COVID-19 vaccine has been long anticipated. Today, the new lower dose pediatric formulation of the Comirnaty COVID-19 vaccine by Pfizer-BioNTech is being authorized by Health Canada as Canada's first COVID-19 vaccine for use in children aged 5 to 11 years. And NACI is recommending that a complete 2-dose series may be offered to children in this age group who do not have contraindications to the vaccine. As well, based on emerging evidence from adult immunization, which suggests longer intervals result in a stronger, longer-lasting immune response and may lower the risk of myocarditis and pericarditis, NACI is also recommending a dosing interval of 8 weeks or more between the first and second dose. As our Health Canada colleagues have indicated, the new lower dose pediatric formulation is 10 micrograms compared to the 30 microgram dose for adults and adolescents aged 12 years and older. Data shows that the 10 microgram dose works very well at preventing symptomatic COVID-19 in children aged 5 to 11 years, with an estimated efficacy of 90.7%. This is very similar to the level of protection achieved with a 30 microgram dose in adolescents and adults. Given the current and prevailing epidemiology of COVID-19 in Canada, where incidence rates have remained highest in children aged 5 to 11 years for most of the fourth wave, today's announcements on the availability and use of the pediatric formulation provides a welcome additional prevention option. Following excellent uptake of the 30 microgram dose among older children aged 12 to 17 years, there has been a notable reduction in infection rates and outbreak-associated cases in that age group. As such, it is hoped that the new pediatric programs will have similar success in younger children and contribute to increased population coverage overall. At this time, NACI recommends that young children receive the 10 microgram Comirnaty vaccine at least 14 days before or after receiving another vaccine. This precaution is being made to help determine if a side effect that may arise following immunization is due to the COVID-19 vaccine versus another vaccine. However, there may be circumstances where it is necessary for a dose of the pediatric COVID-19 vaccine to be given at the same time as another vaccine, in which case a healthcare provider can help with decision-making. To date, no serious safety concerns have been identified in the clinical trials. Going forwards, We will be closely monitoring domestic rollout of the pediatric program in Canada and continuing to review accumulating evidence from international programs and studies. During this time, it is very important that we support children and their caregivers in making informed decisions about COVID-19 vaccination while respecting their choices and pace of decision-making. It is perhaps very fitting that tomorrow is National Child Day and World Children's Day, dedicated to celebrate child and youth rights. This year is an opportunity to say a special thank you to children and youth for the sacrifices they've made during the pandemic and to recognize their resilience. UNICEF Canada is encouraging Canadians to go blue to say thank you. Join in as we show our kids how important they are in shaping their now and the future. From people to places, we can all shine blue for them, including monuments in Canada like Niagara Falls and towers in Toronto and Calgary and more all around the world. So thank you. Merci. Miigwech.
Bonjour à toutes et à tous. Sur le plan national, le nombre de cas quotidiens semble diminuer lentement, mais avec une variation régionale importante dans l'activité de la maladie et les taux d'infection élevés qui persistent dans plusieurs régions du pays. Au cours des 7 derniers jours, une moyenne près de 2400 nouveaux cas ont été signalés au Canada. Les tendances relatives au nombre de cas graves sont toujours en baisse et certaines régions éprouvent toujours des difficultés avec les limites de capacité en matière de soins intensifs, voire au-delà. Comme indiqué, si nous ne parvenons pas à réduire les taux d'infection, les tendances des maladies graves pourraient recommencer à augmenter. En moyenne, plus de 1680 personnes atteintes de la COVID-19 étaient traitées dans nos hôpitaux chaque jour, dont 487 dans les unités de soins intensifs et 25 décès ont été signalés quotidiennement au cours des 7 derniers jours. Au fur et à mesure de l'évolution de la pandémie, nous avons appris, affiné et renforcé les moyens de gérer et de progresser face aux grands défis posés par ce virus. Les vaccins contre la COVID-19 au Canada continuent d'offrir une excellente protection contre la maladie grave et, bien qu'il existe des preuves d'une diminution de la protection contre l'infection au fil du temps, nous continuons à faire d'importantes avancées dans les programmes de vaccination afin de préserver et d'étendre leur protection, de contribuer à réduire également la propagation. Au cours des derniers mois, les approbations réglementaires de Santé Canada et les recommandations du Comité consultatif national de l'immunisation ou CCNI ont permis aux provinces et aux territoires d'ajuster leur programme de vaccination ciblé afin de s'assurer que les populations clés puissent obtenir et maintenir une protection contre la COVID-19. L'approbation d'un vaccin pédiatrique contre la COVID-19 était attendue depuis longtemps. Aujourd'hui, la nouvelle formulation pédiatrique à plus faible dose de vaccin contre la COVID-19 de Pfizer-BioNTech est autorisée par Santé Canada en tant que le premier vaccin contre la COVID-19 destiné aux enfants âgés de 5 à 11 ans. Et le CCNI recommande qu'une série complète de 2 doses peut être offerte aux enfants de ce groupe d'âge qui ne présentent pas de contre-indication au vaccin. De plus, selon les nouvelles données concernant la vaccination des adultes, qui suggèrent que les intervalles plus longs entraînent une réponse immunitaire plus forte et plus durable et peuvent réduire le risque de myocardite et de péricardites, le CCNI recommande également un intervalle de 8 semaines ou plus entre la première et la deuxième dose. Comme l'a indiqué nos collègues de Santé Canada, la nouvelle formulation pédiatrique à plus faible dose est de 10 microgrammes, alors que la dose de 30 microgrammes est destinée aux adultes et aux adolescents âgés de 12 ans et plus. Les données montrent que la dose de 10 microgrammes est très efficace pour prévenir la COVID-19 symptomatique chez les enfants âgés de 5 à 11 ans, avec une efficacité estimée à 90,7 %. Ce niveau de protection est très similaire à celui obtenu avec la dose de 30 microgrammes chez les adolescents et les adultes. Compte tenu de l'épidémiologie actuelle et dominante de la COVID-19 au Canada, où les taux d'incidence sont restés les plus élevés chez les enfants âgés de 5 à 11 ans pendant la majeure partie de la 4e vague, l'annonce faite aujourd'hui sur la disponibilité et l'utilisation de la formulation pédiatrique constitue une bonne option de prévention supplémentaire. À la suite de l'excellente adoption de la dose de 30 microgrammes chez les enfants plus âgés de 12 à 17 ans, on a observé une réduction notable des taux d'infection et des cas associés à des éclosions dans ce groupe d'âge. On peut donc espérer que les nouveaux programmes pédiatriques connaîtront un succès similaire chez les enfants plus jeunes et contribueront à augmenter la couverture globale de la population. À l'heure actuelle, le CCNI recommande que les jeunes enfants reçoivent le vaccin Comirnaty de 10 microgrammes au moins 14 jours avant ou après avoir reçu un autre vaccin. Cette précaution est prise pour aider à déterminer si un effet secondaire qui pourrait survenir après la vaccination est dû au vaccin contre la COVID-19 ou à un autre vaccin. Cependant, il peut y avoir des circonstances où il est nécessaire qu'une dose de vaccin pédiatrique contre la COVID-19 soit administrée en même temps qu'un autre vaccin, auquel cas un professionnel de la santé peut aider à la prise de décision. À ce jour, aucun problème de sécurité sérieux n'a été identifié dans les essais cliniques. À l'avenir, nous surveillerons de près le déploiement du programme pédiatrique au Canada et nous continuerons à examiner les preuves accumulées dans les programmes et études internationaux. Pendant ce temps, il est très important que nous aidons les enfants et les personnes qui s'occupent d'eux à prendre des décisions éclairées sur la vaccination contre la COVID-19, tout en respectant leur choix et leur rythme de décision. Il est peut-être très approprié que demain soit la Journée nationale de l'enfant et la Journée mondiale de l'enfance, consacrée à la célébration des droits des enfants et des jeunes. Cette année, c'est l'occasion de remercier tout particulièrement les enfants et les jeunes pour les sacrifices qu'ils ont faits pendant la pandémie et de reconnaître leur résilience. UNICEF Canada encourage les Canadiens à relever le défi Go Blue pour dire merci. Joignez-vous à nous pour montrer à nos enfants combien ils sont importants pour façonner leur présent et leur avenir. Les personnes au lieu, nous pouvons tous briller en bleu pour eux, y compris les monuments au Canada comme les chutes Niagara et les tours à Toronto et à Calgary et plus encore dans le monde entier. Merci. Thank you. Miigwech.
Merci, Dr. Sharma, Dr. Berthiaume, Dr. Tam, and Dr. Njoo. Thank you. We will now open the phone line to questions. We ask that you limit yourself to one question and one follow-up. We will be taking your questions in both official languages. Nous allons prendre des questions. Nous vous demandons de vous limiter à une question et une question suivie. Vous pouvez poser vos questions dans l'une des deux langues officielles. So, operator, first question, please. Opérateur, première question, s'il vous plaît.
Thank you. Merci. We will now take questions from the telephone lines. If you have a question and you are using a speakerphone, please lift your handset before making your selection. If you have a question, please press *1 on the device's keypad. You may cancel your question at any time by pressing *2. So please press *1 at this time if you have a question. There will be a brief pause while the participants register. We thank you for your patience. Nous allons maintenant passer à la période de questions. Si vous utilisez un téléphone main libre, s'il vous plaît, soulevez le combiné avant d'effectuer votre sélection. Si vous désirez poser une question, veuillez s'il vous plaît appuyer sur les touches étoile 1 de votre appareil. Vous pouvez à tout moment annuler votre question en appuyant sur les touches étoile 2. Alors, s'il vous plaît, appuyez sur étoile 1 maintenant pour poser une question. Il y aura un court délai vous permettant de vous enregistrer dans la file d'attente pour la période de questions. Merci de patienter. The first question, la première question, is from Annie Bergeron Oliver from CTV National News. Please go ahead. Your line is open.
Hi there. Thank you very much for taking my question. I'm wondering if you can talk a little bit about the timeline, how quickly there will be enough vaccines in the country for kids And do you anticipate this vaccine being annual for children?
Hello, this is Theresa Tam. I'll take the first question. There will be another press conference by ministers later on today, and there'll be more announcements in terms of specific timelines for the delivery of the pediatric vaccine from Pfizer-BioNTech. As you've heard before, other ministers have already indicated that we have been working very closely with the manufacturer, and that after authorization from Health Canada, we expect to get our supplies very quickly. But you will need to stay tuned to the press conference this afternoon. But just to add that we've been working very closely with provinces and territories through our National Operations Center to make sure that everyone is ready in terms of the delivery, the logistics, and the rollout of the pediatric immunization programs, so that all the provinces and territories are looking forward to be able to offer this vaccine to kids. As to whether anyone needs more doses of COVID-19 vaccine, it remains to be seen. I think we are continuously learning about this virus and its evolution, as well as learning about the vaccines and the performance. So we need to track to see if the virus itself evolves. But I think it's too soon to say what might happen on an annual basis, but we will be communicating that as we go along as well.
Thank you. Merci. The next question is from Olivier Ferron-Boissé, TVA Nouvelles. À vous la parole.
Oui, bonjour. Ma première question, ce serait j'aimerais savoir, est-ce qu'il va y avoir des mesures pour encourager la vaccination chez les parents qui pourraient être inquiets en ce moment de faire vacciner leurs enfants?
C'est Dr. Njoo. Peut-être que je n'ai pas bien compris la question. Est-ce que vous pouvez répéter la question?
Oui, en fait, je cherche à savoir s'il va y avoir des mesures pour des campagnes peut-être pour encourager la vaccination chez les parents qui pourraient être inquiets en ce moment de faire vacciner leurs enfants.
OK, merci pour la question. Oui, je pense qu'on continue avec nos efforts collectifs à l'échelle nationale, mais aussi avec toutes les provinces et territoires, mais aussi, je pense, à l'échelle locale pour encourager la vaccination pour les enfants, parce que ça fait partie déjà des campagnes comme antérieures pour tous les autres vaccins pour les enfants contre la rougeole, aussi les autres maladies d'enfance. Et puis, je pense que c'est quelque chose un peu, continue avec les efforts, mais maintenant, c'est ciblé sur le COVID-19. Mais c'est un peu différent parce que c'est, comme on dit, un autre vaccin, mais les circonstances sont peut-être un peu différentes comparé au vaccin contre les maladies d'enfance, comme on dit, bien établi. Donc, je pense que c'est vraiment des bonnes nouvelles aujourd'hui, un vaccin approuvé pour les enfants. Et c'est sûr qu'avec les résultats des essais cliniques, Santé Canada a approuvé parce que les données probantes montrent que c'est efficace et aussi sûr. Et on va utiliser ça avec nos partenaires dans les provinces et territoires. Mais c'est quelque chose à suivre parce que c'est toujours une question avec le déploiement des vaccins. On va voir s'il y a peut-être des lacunes ou des défis peut-être un peu en particulier pour quelques programmes dans les provinces et territoires. Et je suis sûr que tout le monde peut ajuster.
Oui, c'est Dr. Tam. Je peux ajouter qu'on va avoir une campagne sur les médias très bientôt, ciblée sur les parents pour donner des renseignements aux parents aussi. On travaille aussi étroitement avec les professionnels dans le domaine de la santé, tout incluant les pédiatres. So we're working very closely with healthcare professionals, including pediatricians, who are the trusted sources, as well as family physicians, pharmacists, and other health professionals that are trusted sources for parents and their kids. And so we're working through all of those channels as we've done in the last many months and the rest of our vaccine campaigns. And so we would expect that all of these players will accelerate their support and communication and provision of information to parents. We will also be engaging people who parents connect with on social media and other channels as well. So you will see that escalating in the coming days.
Question suivie?
Oui, en suivi, je me demandais, on sait que les enfants dans ces âges-là, on grandit, on est en pleine croissance. Je me demandais, est-ce qu'une dose, un tiers de dose, donc un 10 microgrammes, on est confiant que ça sera suffisant, par exemple, pour un enfant de 11 ans qui pourrait avoir peut-être la même physionomie qu'un adolescent de 12 ou 13 ans? Est-ce qu'il y a eu on peut dire des données là-dessus, à savoir que ce sera bel et bien suffisant pour tous les enfants, ce 10 microgrammes-là?
Oui, certainement. Donc, dans le fond, on a analysé les réponses immunitaires chez une population d'enfants de 5 à 11 ans et on peut dire là, avec confiance qu'une dose de 10 microgrammes est suffisante pour générer une réponse immunitaire. Et il faut se rappeler que les enfants ont des systèmes immunitaires réactifs et performants et une dose comme ça va être aussi efficace de 10 microgrammes, aussi efficace chez un enfant de 11 ans, puis va générer des taux d'anticorps similaires, par exemple, à une dose de 30 mg chez des enfants plus âgés. Donc, il n'y a pas d'inquiétude à ce niveau-là.
Merci beaucoup. Thank you. Operator, could we go back to Annie Berthiaume-Oliver? I understand she was cut off from her follow-up. Thanks.
Perfect. Thank you.
Hi.
Your line is now open.
Thank you very much. I appreciate this. My question is whether Pfizer is still considered to be an experimental vaccine. And I'm wondering if Health Canada and PHAC are conducting or planning to conduct any of their own research independent of the Pfizer study.
So once a vaccine has received its authorization, it's not considered to be experimental or in that experimental phase. When we think about experimental vaccines or ones that are in development, those are ones that we're doing lab studies on or through those clinical trials. So I just want to say definitively that we would not consider this an experimental vaccine, and it has been authorized through the regular pathways as we would with any vaccines. In terms of the ongoing monitoring, there are requirements on the manufacturer to provide continued monitoring of all the people that were in the clinical trials, and that includes all the adults and all the children up to 2 years after those clinical trials. But we also have the benefit of having hundreds of millions. There's been over 1 billion doses of mRNA vaccines given around the world, and we're working internationally with all of our counterparts to get additional information from that real world experience as we go forward. So, you know, it really is a global effort, and we're using all of those sources of information. And if anything comes up, then we'll make the appropriate changes to the regulatory status here in Canada.
Yes, it's Theresa Tam. I'll just add that Canada actually has played a significant international leadership role when it came to, for example, the longer interval between doses. Here, NACI is also recommending a dose interval between the first and second dose of 8 weeks or more. So, of course, I expect Canada and my colleagues and the researchers in public health to continue to monitor the vaccine effectiveness overall in Canada, and certainly tracking that in the younger age groups as well, because we will be contributing to the global knowledge on that front. And as I've said in my remarks, the NACI recommendation came as a result of examining two significant aspects for that recommendation. One is our experience in the adult age groups, that the longer interval results in a stronger, longer-lasting immune response. At the same time, it may lower the risk of myocarditis and pericarditis. And all of these research comes from the Canadian context. So we will continue to work with our partners on that front. And as usual, we will be monitoring through our surveillance systems as well the evolution in the vaccine effectiveness, but also safety. So we expect that, I'm really thinking that Canada would again step up and provide that kind of research and surveillance information that the world needs.
Thank you. Operator, we can go to the next question, please. Prochaine question, s'il vous plaît.
Thank you. Merci. The next question is from David Thurton from CBC News. Please go ahead. Your line is open.
Hi. Yes. Good morning, everyone. With the dosing interval that you're recommending, 8 weeks, kids won't be able to be fully vaccinated before the holidays. So can you tell us how protected are kids with only having one dose? And then quickly, are there any concerns with combining, this vaccine Comirnaty with a flu shot? Because, of course, we're in flu season as well.
Yes, I'll tackle maybe the last question first. As mentioned in my remarks, at this point in time, NACI is recommending that the COVID-19 vaccine for children who are 5 to 11 years of age be given at least 14 days apart from the other vaccines, either before or after the other vaccines are provided. This, I think, is normal for NACI, because what we want to do, as we did with the adult vaccines, by the way, is at the beginning, we said separate the COVID-19 vaccine administration from other vaccines so that we can monitor any reporting of adverse events following immunization. But NACI will be re-examining that in due course. I'm going to, in a moment, ask Dr. Tunis to provide any additional comments. But the other question in terms of the stretch interval for completing the full vaccination, we know there are many other layers of protection that we can apply to protect children during this time. We've been doing that. We need to continue to do that. Because as I said, that the epidemiology is a little uncertain at the moment. We're going to get some turbulence, some up and down in our epidemiology in different parts of Canada. So we need to layer on the many different layers of protection in order to reduce community transmission, which is extremely important for protecting children and keeping them at school. And we've been able to do much of that. The vaccine will add another layer of protection. But I think parents need to be provided information that they need to make an informed choice. And the NACI recommendation will be taken into account. But maybe Dr. Tunis can comment on any additional work that NACI will be doing on both of those fronts.
Yeah, thank you, Dr. Tam. So with respect to the co-administration of COVID vaccines in children with other vaccines, as Dr. Tam has outlined, this would be a normal progression that we saw the committee implement early on with the adult vaccines as well, that over time, as we can accumulate more surveillance, there may be a shift towards recommending that those vaccines can be administered concurrently. That is now the recommendation for adults and adolescents, and we've seen that in actual studies that COVID vaccines in adults administered at the same time as influenza, that can be fine. So that's something that we'll continue to watch, and the committee is watching, and that may evolve over time. But in the early rollout, it's going to be important also to be able to contribute to a global safety surveillance community that we can really clearly identify any adverse events that are coming from the COVID vaccine. With respect to the protection during that interval, based on the clinical trial, we don't know what the effectiveness is between the two doses. However, we have very strong evidence from the adult and adolescent programs that when the interval is longer, the final effectiveness is higher. So the protection overall, if we think about the population level, if that's what NACI is recommending on, how do we achieve the strongest population protection? And so our experience with those other vaccines, with the adults and the adolescents, shows us that when the interval is longer, the end result is a higher effectiveness. You can gain approximately 5 to 10% final
improved effectiveness by using that longer interval. And then, of course, there's also, as Dr. Tam mentioned, the precautionary approach based on emerging data from Canada that are being analyzed right now, showing that there may be that you can actually have a lower risk of something like myocarditis with a longer interval. So, well, based on the trial, we don't have an efficacy or effectiveness estimate between the doses. Our strong experience with the adult and adolescent program, and also the basic vaccinology and the biological knowledge that children respond very well to vaccines and very strongly. Their immune systems are very well designed to do this. So there's an expectation that that you would see a similar pattern of immunity and protection during that interval as we have seen with the adolescents and adults. Thank you.
And perhaps just to add, so just on the co-administration, as Dr. Tam and Dr. Tunis has said, the reason that it's being spaced out is because, if you get a side effect in that period after the vaccination, it's good to be able to know potentially what vaccine it's related to. There's nothing about these vaccines, the flu vaccine and the mRNA vaccines, that would cause us to think that there were safety issues or risks associated. It's really just about having an accurate picture of side effects and what they might be related to. On the issue of effectiveness, we do know the clinical trials were set up to have 2 doses. You need that second dose to have that sustained immunity. As others have said, extending that interval may give you more, sort of a more robust, a stronger immune response for longer. And when we looked at the clinical trials, there's not that many cases of COVID-19. So it's difficult to estimate how much immunity you might get from one dose. In the clinical trials, there weren't any cases of COVID between the first dose and the second dose. But again, that was only 3 weeks spaced apart. So that's a small period of time and a small number of cases. If we look at older children and adults, we can estimate potentially about a 50% protection or level of immunity with that one dose. The vaccine has been authorized in Canada as part of that, based on the clinical trials, for a 3-week interval. So I think it really is a discussion with, healthcare practitioners and discussions that we'll have with other provincial and territorial counterparts about whether or not it'll be offered at a shorter interval as well for some patients. So I think it's something to consider especially as we're heading into, as we said, the holiday season, as well as I think a lot of families are considering planning trips abroad, and some of those countries do require 2 doses and might require that for younger children as well. So I think all of that needs to be considered as people are making their vaccination choices.
Thank you. Any follow-up, Mr. Thurton?
Yes, and thank you for those responses. Very fulsome. We appreciate that. Just switching gears here, because of course, there are going to be parents that are really concerned about this vaccine. And I'm just wondering, can any of you who are on the panel on this interview today, this press conference, today, just kind of put this in context? How do the risks of COVID-19 stack up when it comes to, other risks in the day-to-day lives that children face? The risks that we kind of take for granted, whether it's playing sports, whether it's doing other things. I wonder if you could speak to that, or maybe even just speak to, how many children have died or been severely hospitalized by COVID-19, because it's important, I think, that we put this thing in context here.
Okay, maybe I will start. This is Theresa Tam. So as we've said at the beginning of our remarks, children have been impacted by COVID-19 in many different ways. Children 5 to 11 generally get milder illness. Some of them may be asymptomatic, but some of them will get severely sick. And some of them might develop severe outcomes, such as the multisystem inflammatory syndrome that has been mentioned, where the hospitalization rate is very, very high. And so in terms of the statistics, I can provide some of that, but we're happy to provide more later on if you need it. The 5 to 11 year age group now has the highest incidence of all age groups including overtaking the 12 to 17-year-old in terms of case incidence and the younger adults who had been at the highest rates. And there are most of the outbreaks now that are reported to us are from the school and daycare setting, and especially in primary school. So we know that school outbreaks and disruption to education has a big impact on children as well. So that needs to be taken into account. Kids have endured quite a bit during this very long pandemic trajectory as it stands. We need to do everything that we can to help them stay in school and regain some of that normality. And it will allow them to participate more in some of the fun things that they want to do as well. So of the 5 to 11 years of age, we've had about 123,379 reported cases, 300 hospitalizations, 48 ICU admissions, and unfortunately 2 deaths that were reported. So as you can see, the severe outcomes are relatively low. The broader impacts are quite high amongst the age groups. And so I think parents need to be provided with that information to make their informed choices. On the other hand, you've just heard that through clinical trials that have been thoroughly studied by Health Canada through their rigorous process of review, that the benefit outweighs the risks. There was no significant safety signals in these initial trials, and we'll be continuing to monitor that. And parents should rest assured that we will communicate even rare outcomes that might come along as the vaccine programs rolled out. But you've also heard that the vaccine efficacy has been estimated to be just over 90%, which is amazing. And so I encourage parents to discuss these benefits and risks with their own healthcare provider.
It's Dr. Njoo. Maybe I could just add a sort of a personal touch. You know, certainly Dr. Tam has stated all of the good reasons at a population level why, children may be offered and with their parents the Pfizer pediatric vaccine. I can say that, I'm a physician, but I'm also a parent, and certainly looking at the risk and benefits of the vaccine. I've seen what happens in the rare cases of severe illness. Obviously, no one knows what's going to happen in the future with long COVID, other longer term effects in terms of children's health, and as well, the fact that the children's lives have been disrupted. There's many other collateral, I would say, harms, in terms of interruptions with the school year, activities with their friends, and so on. So I would say, without hesitation, as a parent, that I would have my kids vaccinated. It's obviously a bit sort of hypothetical. My kids are all in their 20s now, but I would not, without hesitation, have my kids vaccinated if they were in the age group that would be eligible for the vaccine today.
And just to add as well, I think we need to really, if I'm talking to parents directly, but, of course, it's important to be able to make sure that you have the information to make the choices that you need to make for children. And you can understand if somebody's making a choice about a vaccine, and there's a worry there that what if something happens? But I think, not choosing to get the vaccine for your children is also a choice. And the risks of, things like heart effects. If we're looking at myocarditis or pericarditis, which I know is, it's a concern that potentially might be there for children. In this age group, we think that risk is likely lower than it is for older age groups. But the other thing is that if you get COVID-19, your risk of myocarditis and pericarditis can be 20 times that, estimated for that following the vaccine. As well, with its multi-system inflammatory disease, that can have heart effects as well. And even the long COVID actually has cardiac effects as well. So, I think that it's just that's when we're looking at the overall use of the vaccine and the risks and benefits. That's what we're talking about. We're talking about if you get a vaccine and that it gives you immunity against basically 3 new diseases that we have not seen before: severe COVID, this multi-system inflammatory disease and long COVID. And it also will give children protection against transmission. And we know that with vaccination, your likelihood of getting COVID is lower, so therefore your likelihood of passing it on is lower. And then if you have protection against that, your risk of passing it on because you're shedding the virus for longer is lower as well. So I think it's really important to be compassionate. I think it's really important that parents feel comfortable and confident in their decisions. That starts with having adequate and accurate information. So we put that out at the federal level, at Health Canada and the Public Health Agency. I think having conversations with healthcare practitioners or public health experts is really important as well, so people can feel comfortable with the decisions that they're making. But what we're saying today is we're authorizing the vaccine for this age group because those benefits outweigh the risks for COVID-19.
Thank you. Operator, next question, please. Prochaine question, s'il vous plaît.
Certainement. La prochaine question est de Boris Proulx, Le Devoir. À vous la parole.
Bonjour, merci. Vous avez parlé des fameux intervalles. J'aurais quand même besoin de plus d'explications. Comment ça se fait que dans le communiqué de Santé Canada, on dit que ce qui est approuvé, c'est la série vaccinale avec un intervalle de 3 semaines, alors que le CCNI, vous avez parlé de 8 semaines. Est-ce que le 3 semaines, c'est le fabricant qui le recommande? Et est-ce que ce serait quand même autorisé à 8 semaines et c'est la décision des provinces, finalement, si je comprends bien?
C'est Dr. Njoo, peut-être moi je peux commencer et mon collègue de Santé Canada, Dr. Berthiaume, peut aussi ajouter. Ce qu'on voit, c'est avec l'approbation du vaccin avec Santé Canada. Santé Canada utilise les données probantes, les résultats des essais cliniques. Et c'est ça parce qu'avec les participants dans les essais cliniques, c'est avec un intervalle de 3 semaines. Donc, l'approbation, c'est basé sur les données probantes et alors les renseignements fournis par le fabricant à Santé Canada. Mais le CCNI aussi, finalement, les promesses et territoires ont aussi des autres données probantes avec l'efficacité réelle. On a cru pendant la pandémie et on a déjà constaté avec les adultes un intervalle plus long entre la première et deuxième dose donne une immunité plus forte et aussi plus durable et aussi même si c'est un événement très rare, avec le myocardite et puis péricardite aussi pour les adolescents, on voit que peut-être un intervalle plus long entre la première et seconde dose aussi pour avoir diminué aussi les risques, même si c'est rare pour la myocardite et péricardite. Donc, c'est pourquoi le CCNI, avec les autres données probantes de plus, ont fait leur recommandation pour un intervalle de 8 semaines ou plus pour les provinces et territoires considérés. Et on voit que nos homologues des provinces et territoires ont déjà, considéré les données probantes. Et je pense que quelques provinces ont déjà indiqué comment ils vont utiliser le vaccin pédiatrique avec un intervalle peut-être plus long dans leur propre déploiement des programmes de vaccination.
Si je peux peut-être ajouter, donc, tel qu'expliqué par le Dr. Njoo, Santé Canada revoit les données. Les études qui ont été soumises à Santé Canada étaient faites avec des intervalles de 3 semaines, d'où la recommandation de Santé Canada. Le CCNI fait des recommandations basées sur les recommandations de Santé Canada, mais aussi d'autres considérations pour l'expérience qui a été acquise dans d'autres groupes d'âge durant la pandémie. Donc, c'est pour ça qu'à ce moment-là, chaque province peut décider un peu de l'approche qu'ils vont prendre au niveau de l'intervalle. Merci.
Merci pour ça. Également, j'aurais une question sur les fameuses fioles de 10 mg de sérum de vaccin. Est-ce que je peux bien comprendre que ce sont des fioles complètement différentes qu'on reçoit du fabricant? Est-ce qu'on en a déjà au Canada ou est-ce qu'on pourrait théoriquement prendre une fiole de 30 mg en laboratoire, la diviser pour en faire 3 fioles de vaccin pour enfants ou ça ne marche pas du tout comme ça?
Certainement. Donc, les fioles qui ont été approuvées, qui vont arriver sur le marché canadien incessamment, sont des fioles qui sont différentes. À la base, l'ARN messager que ça contient est similaire. Il y a quelques petits changements au niveau des agents là, pour la stabilité du produit. La concentration est légèrement différente lorsque le produit est reconstitué. On a fait des fioles vraiment différentes. Donc, la fiole adulte est comme un bouchon mauve. La fiole pédiatrique, là, 5 à 11 ans, et un bouchon orange. Donc, la question que vous posez, une question hypothétique, comme on ne prévoit pas qu'il va y avoir là, de problèmes d'approvisionnement à court ou moyen terme avec la dose pédiatrique, il n'y a pas de nécessité d'utiliser les doses adultes pour faire des doses d'enfants. Ça ne serait pas recommandé de toute façon parce que ça implique des risques au niveau de la manipulation, ça augmente les risques d'erreur. Donc, actuellement, le manufacturier et Santé Canada recommande d'utiliser les fioles pour l'usage pour lequel elles ont été approuvées.
Et c'est Dr. Njoo, je peux peut-être ajouter aussi qu'il y aura aussi un autre point de presse avec les ministres plus tard aujourd'hui, je pense qu'à 13h, l'heure de l'Est aujourd'hui, et donc je pense qu'on peut fournir des autres détails à ce point-là. Merci.
Merci. On peut avoir la prochaine question. Next question, please, operator.
Thank you. Merci. The next question is from Laura Osman, The Canadian Press. Please go ahead. Your line is open.
Good morning, doctors. Thanks for sharing this exciting news today. I have a question for you about the NACI recommendations, and I'm hoping Dr. Tunis and Dr. Tam can both weigh in. It's about the distinction between the recommendation for kids 12 to 16 and for children. For kids 12 to 16, you say they should be vaccinated. For children 5 to 11, you say they may be vaccinated. I'm wondering if you can explain the distinction and what it means for sort of the cost-benefit analysis to children, and as well how important it is for parents to vaccinate their children in terms of Canada's larger vaccine strategy to combat the pandemic.
Thank you. I will start, and then maybe Dr. Tunis can provide further details in terms of the NACI decision and recommendation and how they're positioned. But first of all, I would like to thank NACI for all the hard work. It's not unusual at the beginning of any vaccine recommendations for NACI to begin by saying may be offered to a certain group of vaccinees just because of the information that they have in front of them and the size of the trials, for example. But we expect NACI to continue to evaluate that information. And as with some of the adult recommendation, they can shift over time to strong recommendations. But the bottom line is that Health Canada has authorized the vaccine based on the examination of the safety data, the quality, and the efficacy. And NACI has examined that data very thoroughly as well and indicated that this vaccine should be offered to kids 5 to 11. So over to Dr. Tunis.
Yeah, thank you for the question. So as Dr. Tam alluded to, NACI is an advisory body who provides advice to the Public Health Agency of Canada, provinces and territories, healthcare providers, and there's a standard nomenclature of how they approach providing that advice to communicate messages to the decision makers. So it is, this is the way that they express the different levels of recommendation. They have should be offered or may be offered as strong and discretionary recommendations. This is a standard structure that the committee uses. And as Dr. Tam outlined, this is actually a fairly normal progression of advice that we see coming from NACI. If we look at the early recommendations around pregnancy or immunocompromised populations in adults, those started off as discretionary, may be offered recommendations. Same with heterologous or mixed schedules, started as a may be offered. And then as the evidence base evolves and expands and strengthens, then the committee, in many cases, does actually shift their advice towards a stronger should be offered position. So I would say that this is a communication of the state of evidence as things are evolving, it's a fairly normal position for an advisory committee to take early on, and we'll see how things evolve over the coming weeks and months, where we have really close ties with the Center for Disease Control in the US, where we know over 2 million doses have already been, first doses have been administered. And so they have regular channels to present to NACI, and we have communication lines. So as we are learning more, as that body of evidence is growing and growing, very rapidly, then the committee is going to continue to reevaluate. So we'll watch carefully, and we'll adjust that advice as needed as the committee provides us those recommendations.
In terms of the overall impact of pediatric programs, our modeling teams, you've heard of the modeling in the past. They've been doing a lot of work in modeling the trajectory of the pandemic and inputting the impact of vaccinating younger age groups, as well as some of the knowledge that we have and uncertainties about waning immunity in different age groups. So there's still some uncertainty in their modeling estimates, but certainly in combination, increasing booster doses to the segments of the population that is experiencing waning immunity, as well as increasing vaccination coverage in younger age groups, together will serve to help get the pandemic further under control. And so there will be a contribution of vaccination of this age group to the trajectory of the pandemic. It all depends on the level of uptake, of course, in this population, as well as the timing of the epidemiology and the different ups and downs that we might experience in the coming weeks and months. But we do expect that to provide a contribution to the impact of the pandemic.
Any follow-up?
Thanks so much. And this is early days, obviously, but as doses start to go into the arms of kids, the federal government and provincial governments are going to have to start to think about whether their vaccine mandates are going to apply to children, particularly at a federal level for, airplane travel, that sort of thing. And so I'm wondering, Dr. Tam, what your recommendation would be at this point as the federal government starts to consider those measures.
Well, at this point, our perspective is that we shouldn't include a pediatric mandate at this point. The vaccine program is just rolling out, and there's very little access anywhere else in the world to pediatric vaccines. We're one of the first countries that have been privileged, I would say, in getting these pediatric doses. And so for the purposes of travel, for example, I don't expect that we will be requiring this. But of course, we'll be examining all of these policies as time goes by, but not at this point.
Okay, thank you. We'll have to end it there. This will conclude today's technical briefing. Thanks for your participation. Any additional questions can be directed to Media Relations at Health Canada and the Public Health Agency of Canada. La conférence de presse est maintenant terminée. On vous remercie de votre participation. Si vous avez d'autres questions, n'hésitez pas à communiquer avec le Bureau des relations avec les médias à Santé Canada et l'Agence de la santé publique du Canada. Merci et bonne journée. Thank you and have a nice day.